Hello, and welcome to the Surgical Assistant Podcast, a podcast crafted by surgical assistants for surgical assistants, where professionalism meets passion. Because I'm not there. So, hi, everybody, and welcome to the Surgical Assistant Podcast. I'm John.
I'm Kelly. Welcome.
Hey, Kelly. So, tonight's topic is professional resources. And it's something that I avail myself of, and I know Kelly does. So we're going to give you a short but by no means exhaustive list of the professional resources that we use. We have different categories. So just to give you a brief rundown of the categories, just a brief rundown. I'm not going into anything in the categories, but you have conferences, textbooks. We have our reps. There's podcasts, YouTube and Facebook. So there's a ton of resources out there. And I guess to start us off, we'll talk about conferences. So the Surgical Assistant Association, whichever one you belong to, whether it's the NSAA or the ASA, they put on a conference every year. The NSAA ASA joint conference is in April this year. It's April 25th through the 27th. So Friday, the 25th is your registration, and it's a day of hands-on workshops. So it's considered the pre-conference workshop because the actual conference is on Saturday. And then that's when they have all the scientific presentations. So that starts at 7 a.m. with breakfast, and then 8 a.m. they start with the lectures, and it finishes at 5 p.m. And usually there's an update on legislation. So there's a lot of great reasons to attend that conference. And then the ASA has a conference in September, and that's the last weekend in September. I don't know what the topic is on this year or what city it'll be in, but typically the cities change, and I highly recommend that you go to a conference, either ASAA or NSAA. It'll blow your mind. I know it did me the first time I went, just to meet other surgical assistants. But Kelly, would you agree with me that just the CEUs are not the only reason to go, right? People say, well, I don't need CEUs, or I get my CEUs this way, but I think that you are severely limiting yourself if you don't go to a conference.
Right. Yeah. We need CEUs. We know that certification, that recertification is coming around every 2 years. We need them anyway. We need advanced ones. And to me, this is a much more fun and enriching way to get those. It's just, you never know what kind of nuggets of information you're going to walk away with, in addition to, meeting other first assistants and seeing people face to face that you may interact with online on some of our, membership groups. So yeah, I would agree with you. It's fantastic opportunity to go in person and learn and just kind of convene together. And yes, there's a cost involved. And, we've talked about that we put enough value on our profession. We appreciate our profession enough that we do want to invest that way. And you and I advocate for that, really, just trying to elevate ourselves in our profession and the way that we carry ourselves and present ourselves, that we just are able to enrich ourselves in that way. So I've gotten some really cool tips at some conferences, and I'm going to share a couple of them today that I've gotten. So I look forward to that.
Yeah, that's great. I cannot recommend enough that not only our own conferences, the Association of Surgical Assistants and the National Surgical Assistant Association, those conferences, but I branch out to other conferences. For instance, last year, I went to the Maddox Trauma Conference in Las Vegas. It's one of the longest running conferences. I went April of last year. It was the 57th year consecutively. They haven't missed a year yet. That even in COVID, they had an in-person meeting during COVID, but that is the Trauma and Acute Care Surgery Conference. Dr. Maddox has been running that conference for 57 years, and it's amazing. I mean, any movers and shakers in trauma come to that conference, and he has them present. So if you ever read a paper on, resuscitation in the trauma patient, or REBOA, or preperitoneal packing for pelvic fractures, those authors are at that conference. Kenji Ianaba from LA County, Demetriades from LA County, Jennifer Gurney, who is the head of the DOD's trauma registry, she presents there. I mean, these are the number one, clinicians that are practicing and coming up with the new therapeutic guidelines for the patients we treat. So I attended that conference, and it was mind blowing. It's open to clinicians. So It may not specifically say surgical assistant, but if you look at the registration page, somewhere in there, you'll find where you fit in. It might be non-physician attendee. It could be advanced practice provider. But if you don't see
Mhm.
anything like that, send an email. There'll be an email for point of contact for the conference. And I wasn't sure if
Right.
I could go or not last year, so I emailed Mary Ellen, who handles all the admin stuff for Dr. Maddox. I emailed her, pardon me, and I explained to her my situation, told her who I was, what I was, and why I wanted to attend. And she said, "Please, yes, use this one when you sign up." So,
Yeah.
I now I'm going this year too. It was just so there were 1,200 surgeons at that meeting. Well, 1,200 attendees, I shouldn't say surgeons. Some were advanced practice, some were surgeons. So, but then you have the American Academy of Orthopedic Surgeons. That conference is going to be March 10th through the 14th this year in San Diego. Breast surgeons, yours is going to be, when is that coming up? Bariatrics is June 15th through the 19th. And plastic surgery in Austin, Texas, March 24th through the 27th. Neurosurgical conference, April 25th through the 28th in Boston. Or there's the cranial and spinal one put on by the Mayfield Clinic in Cincinnati. They do it one every year in Snowmass, Colorado, and that's February 23rd to the 27th. But I encourage you to just get online, and if there's a professional organization, they have a conference and you are able to attend. They're a little more
Yeah.
pricey than our conferences, but it's definitely worth it. I think especially if you work privately for a surgeon or for a group in a
Right.
specialty, you should attend that specialties meetings, whether it's bariatrics or, whatever, but I
Mhm.
think you need to attend that. So what are you have any other
Yeah.
thoughts
I
on
mean, if you're
conferences?
if you're a coordinator, if you do specialize in surgery, I would
Oh,
encourage you to try to
definitely.
go to especially I mean, there's gonna be a conference for every specialty, vascular included. I don't know if you mentioned vascular in that list, and also robotics. I mean, the, intuitive, you can look up if there are any intuitive Da Vinci conferences
Mhm.
coming close to you, but also your reps are a tremendous resource in that. And we're gonna talk more about reps in just a little bit, but
Mhm.
as far as conferences go, I would think your Da Vinci rep would be able to tell you of anything coming up that might can attend. So, and that would be, Da Vinci to me is more just of general surgery, but yeah, any
Mhm.
specialty like it's just gonna enrich you and make you better.
Mhm.
Um, Again, you have to weigh, and all of us, you have to weigh, is it cost prohibitive? Is the cost of it, is it gonna
Mhm.
versus the benefit that it's gonna give you in your everyday job. I mean, at the very least, it's going to give you general information and knowledge and education that you are going to be able to use in your role in general. But as far as getting into the, specialties and the ins and outs of the specialties, I think that, we all have to weigh, is it worth it for me to spend that money and go? I mean, Vegas isn't a bad location. You're
Yeah.
going to a
True.
conference in Vegas,
Mhm.
that's nice. I mean, make it a vacation conference, do a what do you call it? A destination conference where you can enjoy some time off too, maybe while you're there. That's a good idea. But yeah,
That's a
I
great
would
idea.
agree. And I haven't really branched out. Now, when I did was working in vascular surgery alone, was able to attend a couple of vascular specific conferences that I really, really enjoyed. But yeah, and I'm looking right now, I want to, in addition to our societies, our organization conference coming up, I want to look into a Da Vinci. I do wanna look into some maybe advanced robotic conferences to go to, just to kinda enhance those skills and learn some things. But yeah, conferences are a fantastic resource and easy to kinda overlook because it's not
Mhm.
really something that's in our face or that we're required to do for our job. And did you get CEUs for that trauma? Did you get any kind
I
of
did,
proof of
yep,
CEs?
I did. That's one thing you're worried about. I mean, all of these conferences give you Category 1 CMEs or continuing medical education units,
Right.
and they all transfer to us. I emailed Jamie Riley well, actually, I spoke to Jamie Riley in person at the conference, the surgical assistant conference last year, because I attended that one right after the Maddox conference, and I think I got 35 CEUs for the Maddox
Oh,
conference.
wow. Oh
Yeah.
god, that's a
And I
lot.
asked Jamie if they would. She was like, "Yeah, they'll all apply, but you'll have some left over." And this year I have to recertify for the DSTSA, and I'm just going to
Mhm.
use their form, and I'm going to put my certificates from the Maddox conference for last year on there because, like I said, that's easily 35
Right.
CEUs that will transfer over because they're actually considered one level higher than our CEUs. So
Okay.
whatever your credentialing organization should accept them. But if you have a question, just send them an email, the
Yeah, so that's good
MVSDSA,
information.
ASP,
Yeah,
or Jamie, or anybody at the NSAA who the point of
yeah,
contact is for the NSAA can tell you.
yeah.
So,
To get the C we've gotta get the CEUs anyways. We've got that recertification coming up, like I
yep,
said, and to me, it's just a more fun and enriching way to do it. So if you can swing it, if you can
exactly.
plan it, even if you go to one every couple of years, try to think that direction for yourself professionally and try to do that for yourself, and we don't think that you'll regret it. So,
Oh, I know you won't
pick
regret it.
something that you're interested in. I mean,
Right. My personal feeling is if you are a surgical assistant and a member of either organization, you need to attend one of their two conferences every year. I mean, you just need to because yes, CEUs are a great reason that you get for going there, but it's the intangible stuff that in my opinion is worth more than, what you'll pay for the conference. So, and they try to usually give them, you know, in all regions, so people from California don't have to fly to New York. We do give one in Arizona. We do have a conference in Las Vegas every couple of years. They tend to cycle around through the same cities, but like Texas is good for both coasts to attend to. So this year's is in Grapevine, Texas, or Dallas, Texas. They gave one a couple of years ago in Las Vegas, so people from California could come. But I definitely think if you're a member of one of those two organizations, you need to attend that conference at least once a year because it's the networking, the people you'll meet, you'll make friends that you see every year. It gives you legislative updates. One thing that we intend to do on this podcast is continue with legislative updates, but your professional organization, if you consider yourself a professional, you need to attend their conference. That's just the way I feel. And then if you can afford it, and you want to go to other conferences, like the Maddox conference or a breast surgical conference or something like that, then by all means inquire and go. But like you said, Kelly, yeah, the Maddox conference is in Vegas. It's always in Vegas. It's always at Caesar's Palace. It's been there since day one and it will always be there. But you can plan for it, and as far as I know, all these conferences are tax deductible because they're professionally related, so, like Kelly mentioned, make it a destination, coordinate with your spouse or your family and do a vacation in that area, and, oh, by the way, for the first 2 or 3 days, you'll be at a conference, but then, you know, you can have
that's a
time
great way
after
to do
that.
it, in my opinion.
Sure,
That's just,
especially for Vegas, I mean,
yeah,
adults
yeah.
playground, I mean, it's
Kill 2
wonderful.
birds with 1 stone, get
Yeah,
and then you've got the CEU. See, yours that's so great because now you don't have to worry about, your CEUs for your certification. You've
yep,
got them or most of them. So, yeah,
true.
that's pretty cool.
But I know
And
all that say, "Oh, well, I use my hospital in services or I do that and I don't have to pay for it." Okay, that's fine. But like I said,
that's
CEUs
yeah.
aren't the only reason to go. If you're only going for
No,
CEUs, you're missing
no.
out because there's so much. There's a
Right.
pre-conference workshop. That hands-on workshop is invaluable. I mean, they give
Oh
them
my
on so
goodness, I
many great
know.
things. We got one coming
Learning
up.
about those
Yeah, I was talking to
getting your
Michael.
hands
There's
on
gonna be one.
new devices
Exactly.
and
Yep. Yep. There's gonna be one on ultrasound. We did one on
Uh-huh.
endovascular vein harvesting. We did, there's
Mhm.
ones. Arthrex did a wet lab one time on shoulder surgery where we actually had
Uh-huh.
cadaver. I couldn't attend that one, but so there's wonderful opportunities like that. And I think that you need to
Yeah,
avail yourself of that. And if you consider
for
yourself
sure.
a professional, you need to for professional development. But in
Yeah, I don't
addition
know if
to
the
that,
agenda's out for that one yet. I haven't looked to see if they've got the agenda. They usually don't have it out this early, but
yeah, I haven't
I'll be
seen it
looking
yet
forward I'm
either.
always looking forward to seeing the agenda for the ASA and SAA conference.
Yes. And there
In
isn't
Dallas, yeah.
there is an additional cost for the hands-on workshops, but
Mhm.
it's definitely worth it, I think.
Yeah.
And
Yeah, I feel
then
like the quality has been there for sure when I've done it,
oh,
so
definitely. And, so for that, we can segue into the next resource, which is your reps. We can just go right into that since you brought it up
Mhm.
on the,
Yeah.
conference one. I mean, whatever your rep specialty is, I mean, whatever rep I see, I ask them, "Hey, do you have any educational opportunities coming up?" Whether it's Ethicon for wound
Oh,
closure or Da
many.
Vinci.
I
Your Da
know.
Vinci is a great rep. When I was working in Georgia, I got to go do a first assistant course for bariatrics, so first assisting in
Mhm.
bariatric surgery.
Mhm.
Fantastic. And the Da Vinci rep set me up with that. There was no cost to me for that. A lot of times there isn't when the reps set you up with
A lot of
with
times there isn't.
courses.
That's right. That's a big.
But
Big
you
thing to
don't know if
remember.
you
Yeah.
don't ask, and I
If you don't
always
ask.
ask.
Yeah.
Every rep that
Mhm.
comes in to give an in-service, I ask, "Hey, do you have any educational opportunities coming up? Any conferences, any this, any that?" So,
I
that's a
mean,
definite resource to use.
Ethicon is another
Mhm.
one.
Yeah.
I've gone to some really great Ethicon workshops, again, just by virtue of talking to the rep, finding out where the workshop was taking place locally.
Yep.
I went, it was no cost, and great information. So Ethicon is another good company
Yep.
that just came off to the top of my head.
Oh,
But,
yeah.
gosh, you think about all the special vascular,
Mhm.
urology, mesh,
Yes.
BARD. BARD is another good one, BARD mesh. And again, guys, we're not, I guess, I don't know what the ins and outs are, John. We should give a disclaimer. None of these, we're not sponsored by any of these
Oh,
people
true.
that we're
We get
mentioning.
no
We
sponsorship
have
from
no
anyone yet.
relationship, sponsorship, or anything. We're just pure experience is what we're
That's
talking about here. So, when I throw names out like BARD, that's just one. They have a good mesh product. I've
right.
met some good BARD reps that have stood in a hallway and educated me about
Mhm.
their mesh product. And but any of these reps that you come in contact with, and they're at your facility, gosh, talk to them. If it's just grabbing them and talking to them in the hallway
Mhm.
and finding out specs about a product, they're so knowledgeable. I mean, it's literally
Yes.
their job. Their job, guys, that we don't see in the hospital, their job is to sell that product to that surgeon, so to speak, like to get them to at least try it, trial it. And so they're in the offices and whatnot also
Mhm.
before they come to the hospital. So
Yeah, they are a technical
GYN,
resource, and they're in that
GYN
room for that
products.
purpose. Yep.
Yeah, the Hologic devices, the MyoSure, just
Mhm.
gosh, I could just keep naming techs. Reps, we both could. Ortho reps are a good
Sure.
one too. Just
But reps, I
they're
think, are a
full of
good
knowledge and information.
they're a good underused resource. Now, not so much
I
for me
think
as a
so.
traveler, but if you are an employee somewhere, and it behooves you to create a relationship with those representatives
It
because
really
they
does.
know the influence that we have. We can suggest products
Yes.
at the right time, the right product for the right patient at the right time, and it might not be
Mhm.
something the surgeon has thought of, but maybe you saw an in-service on it the week before, or you learned about it the
Mhm.
week before. So, and I've
Yep.
talked to Ethicon reps and I said, "Hey, do you have any wound closure classes coming up?" They're like, "No, but we can put one on. Do you know enough people that would be interested in
Yeah.
going?"
And you
And they
get a
usually do
list
it at a
together. Yep. I've done the
restaurant. You
same
get a free
thing.
meal
Uh-huh.
out of it. I
The
mean,
hotel conference
it's
room.
great.
Uh-huh.
Right, exactly. So there's no harm in asking, and a lot of times if they don't have one, they can put one on,
Yep.
and, they
Mhm.
have a budget for that, and it behooves them because they know that if they have you in there as an advocate,
Yeah.
and like Kelly
Yep.
said, we are not sponsored by anybody, although we're not opposed
Nope.
to it, but as
No.
currently we are not sponsored by anybody,
Right.
so this I whatever I suggest is right for the patient at the right time. Nothing sways me, and it just irks me to no end that reps can no longer give away pens in the operating room because the
I
government thinks
know.
that's gonna influence the decisions we make. It's
I
stupid.
know.
We're in medicine, we do what's
Mhm.
best for the patient no matter what. Why do we
Mhm.
use 80 units of blood on an 80-year-old? Because we try every effort. Should we? I don't know. That's
Right.
another question
Right.
for another time. But
Yeah.
you have these resources, utilize them, and you don't know until you ask, you
So,
know?
yeah, and it's like when you're standing there talking to a rep and asking questions and getting information, that's like free school, guys. I mean, that's like you're literally getting an education
Exactly.
for free. I
Yep.
mean, they'll tell you everything they know, and it's
Yep.
good stuff that we need to know.
I agree. Resource. Textbooks are another resource. I have quite a
Text
few textbooks. Um,
Textbooks are more old school. I mean, and I've gotta be honest,
yeah.
John, I'm gonna tell my age here, but
Yeah.
when we first discussed having this episode and talking about this, textbook was the first thing that came to my mind. I mean, I'm
Yeah,
from the
mine too.
generation that if I was studying something in school or had a paper to write, I went to the
Mhm.
encyclopedia. We had a
Oh, yeah.
set of encyclopedias in my house, and that's or to the library, and that's how I researched papers. So, textbooks are the first
Mhm.
thing that I thought of, and I'm very comfortable and endeared to having an actual book in my
Yes.
hand to
I
read,
have to hold a
I
book.
want something in my hand, I like it. I have a Kindle app, I love reading my books, I love audiobooks, don't get
Mhm.
me wrong, I listen to podcasts and all this, but I love to hold a book in my hand and read it.
Yes.
And so,
Do you wanna show us that book?
I
What is that? Because that is a great
if that's
resource,
your
by the way.
thing, we all know that we have a lot of downtime in the operating room sometimes. If it's
Mhm.
slow, if our case canceled, I actually like to fill my time with something useful. And
Mhm.
so one of my favorite this book called Surgical Recall, you can see it's very well used and worn. And then I got a little updated version just because I found it in a used bookstore that I was in.
Hmm.
in Nashville, in the Nashville area. I found the fantastic used bookstore there, and they had a medical section, and I found this updated version of Surgical Recall, and I also have the advanced Surgical Recall, so this just got a little more, but this is a book, if you don't know, that is geared towards surgical residents, and it's in bullet point format. So, I mean, it starts everything from the initial history and physical. I know it's hard to see on the camera, but you can see like it's bullet point. It'll have
Hmm.
something here and then the information over here. I mean, it's got an anesthesia section. It's got a history and physical section
Hmm.
for the surgical resident. If you think of it from that perspective, it's giving them the wide range. But then it goes into surgical specialties too. So just little bullet points. So very easy to read.
Hmm.
Lots of little nuggets in there about anatomy and surgical approaches and, some things that don't pertain to us, but it doesn't hurt to know either. It doesn't hurt to know how the physician is thinking. That actually is helpful to know how your surgeon is thinking about things. So those are two of my favorites to have. They're just compact and I can take them and have them in my locker. So if I
Hmm.
just need something to grab and just want to browse through something, those are really good. And a lot of it has to do with the bullet point. I love the bullet
Hmm.
point format of that because it's easy to read. So those are two of my favorites just to have. Yeah, paperback and
Yeah, it's a lot of great information. Even if books aren't your thing, all of these come in an electronic version, a Kindle
sure.
version, or you can get
Mhm.
it on,
Correct.
whatever electronic format you like. That's the greatest part about it. But I think
Yeah.
these things they're invaluable. Yes, they're geared towards clinicians, but it, me myself as a traveler, I have to be able to do every specialty that I'm assigned
Mhm.
to. Granted,
Yep.
cardiothoracic I don't do because I don't know hearts. I don't know how to do open hearts. I don't have that much experience in endovascular, and I don't have that much experience in robotic prostatectomies. But if it's a case, if you work at a place or you work for a group, but let's say it's a case that you don't do a lot of or haven't seen a lot of, these resources are tremendous, tremendous to have. I mean, I can't tell you how much I've got, books on trauma. I've got Schwartz's surgical textbooks, volumes 1 and 2. If you do hepatobiliary surgery, Bloomgard's book on hepatobiliary surgery, volumes 1 and 2. Tremendous resource. Now, granted, these are expensive. Some of these books are expensive. Like Campbell's
Right.
Operative Orthopedics is a 4-volume set, and it's probably 1,000 pages each volume. I think that's over $500 for all 4.
Mhm.
But you may
But
be in
again,
a
like I mentioned,
situation where
find
you
a
can get
used
them.
bookstore,
Yes.
especially if you live in a college town or somewhere close to that. I'm pretty sure Nashville had a really good used bookstore, but most towns do. Most cities
Oh,
do
yeah,
have
you can
good
find those
used
great
bookstores these
talk to your
days. So
surgeons, you know?
talk to your surgeon, see if they have any books. One really good basic, and I kept all my books from school, from
Oh,
FA school.
definitely.
I
I
mean,
have
I've
all
got all
those,
my
yeah.
textbooks, but one of my favorite basic books to have is Netter's Anatomy, the illustrative. It's all illustrative on human anatomy
Mhm.
by Netter. I still refer to that book, John. I mean,
Yep, that's a great book.
there's just no end to the reference that I need to make to that book. I mean, there's just no end because I'm never going to know everything about human anatomy.
No,
And
true.
we all know his drawings are number one. I mean, his
Mhm.
it's just fantastic. And in fact, when we were planning this podcast out, it reminded me to look because early in my FA career, I had a small Netter's book that it was a pocket guide and it was
Oh,
specifically
okay.
for surgical anatomy and surgical
Oh, wow.
approaches. And I used it to where it came off the binding. I mean, I just referred to it. It was like a little quick reference.
Oh, okay.
And I either lost it or it tore up. I think it tore up and I had to I finally threw it away. And ever since, I've always wanted another one. And
Mhm.
so for a while there, I thought I had looked for it and I couldn't find it. And I thought, well, maybe they just stopped making them. But when we were planning for this episode,
Mhm.
I looked it up and by George, there it was. It's Netter's Anatomy. It's PRN. So
Oh,
it's
okay.
I looked at Netter's Surgical Anatomy, PRN is what it's called. So
Oh.
it's like a pocket edition. It's
Mhm.
compact. You could put it in the pocket of of a lab coat, something to have in your locker. So that's a very good resource because if it's a
Mhm.
surgery that maybe you don't do a lot or something
Right.
that's new to you, you can refer to it. It'll tell you those landmarks and landmines that we need to talk
Mhm.
about I like to talk about in the surgery, the typical surgical approach, anatomy the pertinent anatomy that you need to know. So
Mhm.
that's a very good resource. I actually ordered myself
That's great.
one, and it was only
Oh,
like it's
fantastic.
only like $25, yeah.
That's
So
great. Yeah, the book I keep in my locker
mhm,
is Hoppenfeld's Surgical Approaches for Orthopedics.
mhm,
So, I do a lot of
okay,
orthopedics and, if I haven't done a certain type of surgery, I can look it up and find out what the approach is, see what the positioning is, find out what the
right,
landmarks are and the
mhm,
landmines because it gives you the dangers
mhm,
of what nerves to look out for, what vascular bundles to look out for. So, I mean, it's invaluable. But they
right,
can get pricey, but then again, I believe all these things are tax deductible. But, my disclaimer is I'm no means a tax expert. Consult with your accountant for that kind of stuff.
right,
But these are
if
professional
that's important,
resources,
yeah.
just like your shoes, just like, your
Uh-huh,
textbooks, they are deductible. So, but I think, if you have a specialty that you do and you love all the time, then acquiring a book like I have Zollinger's Atlas of Surgical Procedures. It's got like quite a few of
yes,
the basic procedures in there that we do with illustrations. I even found an old book
that's a
from
good one to
Ethicon
have,
in
the
the 70s. I think it was
Hollingers.
published in 1972. And it's
Uh-huh,
basically a little book by Ethicon and it goes over some suture material, suturing techniques, but then it gives you like, your basic abdominal procedures like a Billroth 1, a
mhm,
Billroth 2, which we don't do
mhm,
anymore, pretty much, and then Hartman's procedure and all this stuff. It's really cool.
right,
I think I found that at a used bookstore as well. But the the list is endless. If you're interested
it's
in it,
endless, yeah,
it would behoove you to, have a book like that. It's not gonna hurt. It's just gonna make you a better professional. Um,
mhm.
so we talked about conferences, textbooks, reps, podcasts. That's another one.
Podcast,
Hmm. Like if
the
there's
number 1 podcast we recommend
exactly, I hear
of
there's a
all.
great one for surgical assistants.
For surgical assistants, John, can
I've
you
heard that, yes.
imagine? I
But there
know,
are there are
fantastic.
other ones. Kelly, you mentioned one.
Yeah, Surgery 101, is
Mhm.
that the one I mentioned? And, well,
It is.
John turned me on first of all, John turned me on to Behind the Knife, which
Yes.
has been fabulous. So if you don't know about these podcasts, write them down. Behind the Knife
Mhm.
is much like the book Surgical Recall that I just held up, is geared towards surgical residents studying for
Yep.
their board
Absite
certification,
exam.
I
Yep.
believe. Yeah, the ABSA,
So
yeah.
the Absite they have to take every
So
year. They're a surgical resident, the way I
oh, I'm
understand it.
sorry, okay.
Yeah.
Yeah.
So they have
So
to take that every year, and it's important. It can be a determining factor where you go.
we've
So,
gained some I've really gotten
oh my
some
god, I
really good
learned so much from
information
that
on that.
website.
I
Yep.
love that website so much. It's guys, they're shorter
Mhm.
episodes than I mean, typically they're really short and bullet pointed episodes. They're very focused on what they're talking about. And I like it because they use students to do the podcast,
Yeah.
like it's a question and answer format kind of,
Yep.
and they use residents or even medical students I've heard. So I really, like that they do that. Lots of good information on that. So that's Behind the
Oh, yeah.
Knife.
Behind the knife. They have their website, actually, they have
Yeah.
videos, like procedural videos. They do one
Oh, there you go.
on trauma. I believe I forget it's gotta be maybe 15 or 20, if not more, procedures that they do on perfused or plumbed cadavers, which are cadavers that you actually charge up their vascular system, use a fluid that
Mhm.
doesn't extravasate, and you basically put a cannula in their artery and a cyclic pump pumps, blood,
And it
a substance
mimics.
that's like blood,
Yeah.
right? They bleed. If you stop the bleeding, it'll stop. So it's great for surgical patients.
Mhm.
It's great for the militaries using those now. It's called the ACTOR program or the Advanced Cadaveric for Operational Training Realism, I believe. And they use perfused cadavers to teach like PJs the proper way to do field expedient amputations
Mhm.
because we can put a jersey barrier on their legs. They have to do if you put a tourniquet on and don't stop the bleeding, you're going to know because the patient's going to
Right.
continue to bleed until you actually, torque that down tight enough to stop the bleeding. So it's a great high fidelity resource for that. So the military's using that and they use it in their trauma videos on like, trauma laparotomy. And it's a great resource. If you don't do a lot of trauma and you want to know about a trauma laparotomy, their their videos are fantastic. It'll teach you everything you
Mhm.
need to know to be a good assistant on stuff like that. So
So that kinda crosses over from going from podcasts into, like, websites and I guess, is that a
sure.
website that's on? Yeah.
Well, it's the podcast website, so,
It's the
it's just
podcast website,
another
okay.
extension of their podcast, but yeah.
Okay, yeah.
So there's Surgical
The other one
One.
I mentioned to you was the Curious Clinicians, which
Oh, that's
wasn't
the other one, yeah, Curious Clinicians.
necessarily surgery specific, but still kinda resident in that student doctor format and just good information. I just, look, if I'm on a long drive and I'm tired I
Mhm.
mean, as much as I love music, sometimes if it's a long enough drive, I just get tired of listening to music, so I wanted to switch it up. I'll listen to, audiobooks, podcasts, but it's nice to know that these podcasts are out there and we can have something to listen to and
Exactly.
educate ourselves at the same time, so
Yep.
yeah,
That's a
so
good
those are
thought.
just a
Yeah.
few that we know of, but I've really enjoyed
Yeah.
Behind the Knife. That's a fantastic
Yeah, and
one.
I know it sounds basic, but I mean, this podcast is for everybody. So there's people who are brand
Mhm.
new into it, students, prospective students, or just people interested. But if there's something, in this day and age and you want to learn about it, you can find a resource for it, whether it's a podcast,
Yes,
website, YouTube channel, whatever, you can
absolutely.
find it. You are living in the digital age now, and there's no excuse for not knowing something anymore with as
Alright,
available as
yeah,
information is. So, um,
fantastic.
search the whatever your podcast host is, Spotify, Apple Podcasts, whatever podcast, search them and put whatever you're interested in as far as surgery is concerned, and you'll see resources pop up. But I think number one, in my opinion, is Behind the Knife. They're fantastic. And like I said, we're not sponsored by anybody, but I pass that resource along to everybody who wants to know that's a surgical assistant. That is a fantastic, fantastic podcast.
Mhm.
Um, then you have YouTube channels.
Oh,
A lot of universities put their grand rounds on. One that I use all the time that I find invaluable is from Harborview out west, and their Husky Orthopedics is the name of their YouTube channel, and they put their orthopedic grand rounds on YouTube. Every year they do a LaCoque seminar, and they put that. It's a 2-day seminar. They put those videos online, and it's all free.
wow.
And in fact, my sister got me for Christmas this year, she got me tips and tricks in fracture care that's put out by the physicians at Harborview. So it's all these little tips and tricks on reducing fractures or, how to fix them. If you have a difficult fracture, what kind of pearls they give you for doing that. And I just nerd out on stuff like that. I love to read about it. So will I ever
Mhm.
get to use that? No, I'm not an orthopedic surgeon, but
Right.
it can help as a
I can.
resource sometimes if you're in a difficult thing and you're like, "Oh, I just read that. Hey, let's try this," maybe you can suggest it. You never know,
Well,
but
I just wanna address the fact that you just said I'm not an orthopedic surgeon, but I want to remind you and our listeners that in our role as first assistant, we are literally in place of a second surgeon.
true.
While we're not trained to be the surgeon, why would we not want to know as much as we can about what the surgeon knows and
Well,
the surgeon
exactly.
needs to know?
That's the way
I
I've
mean,
always
it's
viewed it.
just not to put too much pressure on myself or anybody else, but it's completely within reason that we educate ourselves to this level. And
Mhm.
it's up to you. You're the only one that can learn things and put things in your mind and devote some of your time and resources to professional development, your own professional development. And it will come in useful. It will definitely come in useful and has. And you could be the hinging point on a difficult case for a surgeon because of something that you read or something that you
Yep.
know or something that you inquired about of another surgeon you were working with. So
Yeah,
my
you
point
never
is
know.
do not underestimate the power of knowledge.
Yep.
Then
Knowledge is
right?
never
I mean,
wasted.
it's never wasted. And
That's right.
so I am so thankful that we do live in the age that we live in, the time and the age that we live in, because these things are so easy to get our hands on. And this technology. One of the things I wanted to bring up about and so YouTube well, wait a minute, let's not go off YouTube for a minute because you also told me about a Dr. Mark Solomon
Oh, yeah,
that's
for,
on
exactly. He's a robotic surgeon. I believe he's in Orlando, Florida. I think he's out of Celebrations. Yeah,
okay,
he's got some fantastic videos on robotic low anterior resection. He's a colorectal
so
surgeon by training, so
right, and I actually think I've seen one of his videos now that you mentioned his name. I don't know that I would have remembered his name, but our our point here, guys, we want to give you these resources. So if it's things that we know
mhm.
of, that we have firsthand experience with, we want to give you this information. So John mentioned that
Yep.
when we were talking earlier, and I wrote it down for myself too. So Dr. Mark Solomon on YouTube, but
Mhm.
anything you put in YouTube, it's kind of easy to find and fish around and get what you want to get. But knowing those
Yeah.
specific names and like the Husky Orthopedics is going to be just help you get to it quicker. And these are things that, he or I both have experience with and
Exactly.
appreciate. So
Yep.
we want to pass that along to you. We want to be a resource for you. The websites, there's any website, any product website, of course, is going to be helpful. But
Mhm.
Facebook groups and pages are helpful
Mhm.
as well. And I told John about the Robotic Surgery Collaborative, which I got the name of that group from one of our surgeons that was speaking at a conference, at an ASA conference that I was at. He gave that information to the group of people that he was speaking to there at the First Assisting Conference, and I went on that day to Facebook and joined that page. So it's called Robotic Surgery Collaborative, and I just like to scan that. This is primarily, guys, this is surgeons talking to each other and conferring with each other about difficult cases or robotic cases that they've done or asking questions. I don't really ever interact on there, but I have learned a lot of cool things from just reading through some of those posts that the surgeons put up and some of the comments that they respond back to each other with. So, like some really helpful things specifically about robotic cases. So, that's a little gold nugget of information too. That's on Facebook. There are other, obviously on Facebook, our organization pages, the members page and the travel, first assisting travel jobs. I mean, if you're listening, you probably know about these things, but there's just an endless supply of resources online between Facebook, the web, YouTube. There's all kinds of resources. So definitely hit those up. Something unique though, and I want people to comment if you know of a resource that we have not mentioned, please comment because I'm always open to good ideas and resources that we can tap into. But something unique that was also given to me at a conference from one of the speaking surgeons were these apps. I'm going to hold my phone up here. I've got it pulled up. So these apps right here, they're kind of all in one spot, and you can see they're from Emory University in Atlanta. And I've got one here on the liver, and y'all, I mean, this breaks the liver down, like, into the lobes of the liver, and it is a lot of information on there, but, just anatomically, if you wanna look at the vessels, you can it just reloaded onto my phone, so it's not gonna act right now. It's kinda being but there's one on the liver, there's one on the lungs, there's one on the pelvis, and there's one on the heart. And these apps are so cool because you open them and they let you like in the heart, for instance, you can put the blood flow on, so it shows you the direction of the blood flow. You can take the arteries out, the veins out. You can have both, like, overlay. You can put your finger on there and you can, like, see it's like a 3D image, and you can see different views of the heart. So here, the liver came up, and that's just a picture, but it's interactive. So it's an interactive app. So when I touch it and I wanna see, like, do a cutaway of the liver right there, and you can see where the vessels are running. Not to go too much into that, but just it's Emory. I mean, just go to your app store and look at Emory Anatomical apps or Emory. I was at a hospital in Charleston on a travel assignment a couple years ago, and I worked with this really sweet young PA. She was with the thoracic surgeon. She started with the thoracic surgeon while I was there. I was there for 6 months. So she was new to thoracic surgery, but I was able to turn her on to that the one with the lungs. I mean, and it talks about tumor staging. I mean, it talks about the different levels of the tumor staging. You can take again, the vessels, you can look at the different lobes of the lungs. You can turn it all kind of different ways, and it shows you how, the lungs in relation to the trachea and the esophagus, and just great information. So, and again, I got that directly from a surgeon because I was at a conference. And that those apps have come in, especially when I was working in CVOR. I did work in CVOR for a year. That heart one was invaluable. I can't even tell you because cardiac anatomy was hard for me. It was difficult for me, and just to see, how all the vessels and in relation and especially the pulmonary veins and arteries coming in, the pulmonary aspect of it in relation to the heart, and it just was hard for me to grasp. That app was fantastic for me as far as learning the anatomy. So that's just a plug for going to a conference and how you get things out of a conference that you can't even imagine that you're gonna get. I mean, it's not you can't imagine the valuable information that a surgeon's going to give to you or another colleague is going to give to you and just in conversation with somebody, but those apps are fantastic. So, I encourage you to go on your app store, look under Emory. Those are Emory specific, but any kind of anatomy apps or might be available, just look that up too, and you can have that right in your palm all the time.
That's great, Kelly. Will you send me those? And then we'll list all these,
Sure
in
will.
the
Mhm.
description so you guys will have, access to
Yes.
them too. But and
Yeah.
there's anything that you guys know about that we didn't mention that you love, please tell us why and send it to us in the
Yeah.
comments. So that would be
Yeah.
fantastic. I mean, it behooves you to keep up with your professional responsibilities, and that includes continuing education, and it's in all forms. If you look around at the other people we work with in the operating room, surgeons, nurse
Yeah.
anesthetists, PAs, they all have their own societies, they all have their
Yeah.
conferences, they all have their continuing education. We have it too, even though we're smaller than and newer than some of these other societies, though we're actively
Mhm.
growing, and we'll just continue to get bigger and our resources will get better. But there are resources out there and you can find them anywhere. You just ask your reps, ask your surgeons. I always
Yes.
ask them what conferences they're going to and things like that. And you just got a ton of balloons go by. That's pretty awesome.
I don't know what
Happy
happened
birthday.
there. I just don't did you do that?
I
I
didn't
don't
do
have
that.
any idea how that
I don't know.
happened.
It's Apple. I can't figure that
Interesting.
stuff out with Apple stuff. But yeah, so
Look, it's doing it again.
oh cool. I don't know. Are you getting a text from
I don't
somebody
know
or
what's happened.
something? But
No,
I
it's
saw a
not my
thumbs up
birthday.
earlier. So
It's funny.
who knows? But yeah, so that's our podcast on professional resources. I would
Yep.
definitely tell you to avail yourself of a conference if you've never been to go at
Yes.
least once. But
Yeah, and we hope to see you in April at the joint conference.
definitely, yeah, come
We're gonna be
find us.
there,
Yeah,
and like I've said
say
in other
hi.
podcasts, like, John and I don't get to see each other very often. We're in 2 different places, and
For
we're gonna meet up at the conference and be there this year.
some of the participants or some of
Uh
the presenters, or there's a ton of stuff we can do. We'll just have to talk
Yeah,
about it, figure it
we've got
out.
time to talk about it and plan it, but we're definitely gonna be there, so
And I'll
we'll
be
look
at the
forward
Maddox
to
conference this year in Vegas, so
and
if you show up there, come find me.
that's very
Yep.
close time frame wise to the joint conference, so
Yeah, it's April
yeah,
13th through the 16th. Sunday, the
and let us
13th is a
know.
standalone conference, and then the other conference is 14th through the 16th. But yeah, it is the week before Easter, and then the
Yeah,
NSAA
right,
conference is the weekend after Easter. So
right.
last year they were
So let
both
us
in the
know if
same
you've
week,
got
so
yeah, they were in the same week.
attend
Let us
both
know
of them.
if you've got any conferences, if you're signed up for anything or there's anything that you've heard of that you wanna go to, let us know in the comments. Anything
Yep.
like we said, that you think we might be
What you
interested
think
in.
a good resource is.
Something that you've gone to that you loved or you didn't like, let us know. We wanna know about it.
Yep. I know that when I was studying for the exam, somebody suggested to me the Quizlet app for studying. So I
Mhm,
used that app to study, and actually a few of the questions that were on that app were actually on the test because they use old versions of the test.
mhm.
So, oh, and I
Yeah.
guess one announcement I'd like to make, and I should have done this at the top of the podcast, but I saw on one of the Facebook posts that the Principles and Practices of Surgical Assisting textbook is finally out. Karen
Oh,
Ludwig
yes.
was the brainchild of Karen Ludwig, who was very active in the ASA, the Association of
Yeah.
Surgical Assistants. Great person, fantastic lady. I got an email from her, as I'm sure many of you did, about, do you want to contribute to the textbook, a section on it, whatever your specialty is? And I know she passed away recently, which is a loss to our community, but the book has come to fruition. Rebecca Hall pushed that forward and it is
Mhm.
now being published. I just ordered mine today.
Very exciting,
Yep, it
yes.
should be shipped, I think, the 23rd of January. So the 23rd to the 27th was the estimated delivery date. So
And
I'm looking
a
forward to
lot of
getting
our
that.
colleagues a lot of our colleagues, like, literally helped write that book, so that's
Yes.
really exciting for our profession, but for our community too, it's just really great. So for incoming students and anybody that's learning to be a first assistant, but for us first assistants as well. So I look forward to getting my copy as well.
Yep.
Thanks for bringing that up, John.
Oh,
Yeah.
you're welcome. And this may open the door, getting into these resources could open the door for you to go further. Maybe you want to become a PA, or maybe you want to become a nurse anesthetist, or a nurse practitioner, or maybe you want to go back to
Mhm,
school and become a surgeon. You're young enough that you could do
mhm.
something like that. That's
Be an
fantastic.
instructor. Mhm.
Yeah,
You
exactly.
could be a teacher or an instructor. I mean, there's all kinds of things to do, yeah.
Yep. So I think that's absolutely fantastic. So yeah, that's all I got for the professional resources.
Alright,
Uh,
yeah.
but we thank you for
Yeah, that was a
joining us.
fun episode, yeah.
Don't forget to like, comment, and subscribe, and leave any ideas that you have for professional resources in the comments. And we thank you for that in advance.
Yeah.
So
Thank you, everybody. We'll see you next time.
take care.
Bye-bye.
Bye.